Welcome! Today we'll be discussing with you about one of the most commonly known and used tests for assessing patients with aphasia. The Aphasia Language Performance Scale, or abbreviated as ALPS, was created in response to the downfalls that many previous assessment tests have endured. Many tests were viewed as time-consuming and required a certain environment, like a room with an electric outlet, or a quiet room and a table, for adequate administration. Some were very formal, which impacted the amount of rapport that needs to be established between client and clinician. The ALPS was created in the late 1960s as one of the first tests with informal testing procedures. The patient's level of performance in each language modality and how this information can be used for effective therapy serves as the foundation for the test development. An informal approach is used from the start to the finish of testing. A casual conversation allows the examiner to obtain a rough estimate of the patient's typical language use and functioning levels. From there, one can already eliminate specific tasks in the test that may be too hard or too easy for the patient to do. 4 10-item scales were produced, each scale testing one of the primary language modalities. These scales include listening, talking, writing, and reading. All scales were designed to test language performance for all patients with aphasia, whether a patient is fluent, non-fluent, or have semantic or syntactic difficulties. When administering the test, it is important to differentiate whether the patient was not prepared for an item, did not understand what kind of response to give, or was attempting to respond but was not able to do so accurately. The first 2 responses are classified as noise in the patient's communication system and are responsible for much of the communicative difficulty that patients with aphasia commonly endure. The inability to respond represents the ceiling level, or the highest level in which the patient can answer correctly. Clinicians must be aware of the 3 various responses because if the test is administered wrong, noise errors will be primarily identified in results and the test will be invalid. Thus, one should practice administering the test a couple of times before using it in actual assessment. The format of the test is very easy to follow and administer. It is suitable for speech-language pathologists with all levels of experience, whether you are a graduate student who is beginning therapy for the first time or have over 30 years of experience in the field. The layout of the test is also helpful in setting goals for therapy.
Scoring the ALPS is a multifaceted exercise in clinician observation and participation. A correct response is considered one which would be expected from a normal subject. 1 point is awarded for a response which is initially correct, or one in which the client self-corrects an error. 1/2 point is given when a client correctly answers only after being given a prompt. All incorrect responses are scored as 0. For each scale, the client's total score is the sum of all items within that scale, a score which should include both tested and untested items. A unique aspect of the ALPS administration and scoring allows a clinician to assume a client's response to be correct even without presenting the items. That is to say, it's not necessary to present the client with every item within the ALPS. Rather, a practiced clinician will know through spontaneous conversation the client's level of skill and modalities of auditory comprehension and verbal expression. If, following this conversation, the clinician believes the client would assuredly succeed to a specific point on the scale, it is suggested the client be given full points for all questions leading to that point. Though helpful in reducing the duration of administration, it's important to begin testing the subject at a point on the scale where he is expected to respond correctly 2 successive times. When the client reaches a level where he responds incorrectly back-to-back, the clinician should note the client's ceiling has been reached, and all following items on the scale need not be administered, and instead they are assumed to be incorrect or 0. In scoring the listening scale of the ALPS, the clinician must be conscious to ignore all verbal responses and focus only on the pointing responses. In order to receive a score of 1 in each section, the client must follow instructions exactly as presented. In scoring the talking scale of the ALPS, the clinician must judge whether a response would be intelligible to most conversational partners. Rephrasing of questions has no detriment on scoring, though prompting of an appropriate response still earns just a half point. The reading scale is very similar in administration and scoring to the listening scale. However, the client's responses are timed. Correct responses are scored 1 point, while prompted remain 1/2 point. There are 2 acceptable prompts in the reading section. The first is providing the client extra time to study the printed card. The second is, in the event of an incorrect response within the allotted time, the clinician may suggest the client reread the card, then answer again. The clinician, however, may not read keywords or the item aloud. Finally, the writing scale of the ALPS is presented. This scale often mirrors the talking scale and is administered and scored accordingly. An important note is that due to right-sided paralysis, many clients may be using their left hand for the first time. Deductions on scoring should not be made for uncoordinated writing.
Administration of the ALPS for the majority of patients has a time requirement of 20 to 25 minutes. For all patients, it should be able to be easily administered in 30 to 35 minutes. The environmental and physical requirements to administer the ALPS is a quiet, free distraction space, or it can be delivered bedside with a lap table for writing. The materials required for the ALPS are the ALPS booklet, score sheet, coins, watch, key, pencil, paper, reading cards, a stopwatch, a small pouch.
Hi, Felicity. How are you?
Fine.
Wonderful. Okay. I'd like you to point to some things, okay? I'll name something and you'll point to it. Point to the door. Okay. Point to your leg, then the chair. Point to the floor, your arm, and wall. Now show me a table and the ceiling in the room. But first, I want you to point to your foot. Let me hear you count like this. 1, 2, 3, 4, 5.
1, 2, 3, 4, 5.
Okay. Okay. How many fingers am I holding up?
1, 2, 3.
Okay, how many now?
2. 1,
Mhm.
2.
I want you to look at some things now and tell me what they are. What do you call these?
Okay, you buy things and you get money.
Okay. Okay. Now, what do you call this?
Paper.
Okay. And what do you call this?
And a time thing. You tell time.
Okay. Okay. What do you call this?
You open a door, home, car.
And what do you call this?
Shirt.
Okay. And what do you call this? Okay. Now, there is a second hand on my...
Time clock.
Okay. And you open the door with the...
With a key.
And turn on the...
Turn on.
Okay. Is this right?
Yes.
Okay. Tell me how many are on this card.
5. 2.
Okay. Now I'm going to show you some words. These will name parts of your body. You don't have to read them out loud. Read them to yourself if you'd like, but show me what they mean. Show me this on you. This card will have a short sentence on it. Read it and do what it says.
Question.
Now, what's the answer to this? Okay, now read this next card and do what it says to do. Okay, read this and do what it says. Can you be more specific? Read it again. Okay, done with these for now. Here's a circle. Now, draw one just like it. Okay, here's a 7. Write a 7. Here is a 6. Draw a 6 just like it. Here's a 4. Make a 4. Now, here's a 2. Make a 2. Okay, now write the first 4 letters of the alphabet. Yeah, so like this. A, B, you complete it.
This test is scored with a numerical score, and that's linked to an impairment rating. So 0 to 1.0 is a profound impairment, 1.5 to 3.0 is severe, 3.5 to 5.0 is moderate to severe, and 5.5 to 7.0 is mild to moderate. 7.5 to 9.0 is mild impairment, and 9.5 to 10 is insignificant. Okay. Our client had a mild to moderate listening impairment. Our client could identify 3 objects but couldn't do it in a specified order. Our client has a moderate to severe talking impairment. She had trouble naming some simple objects. She has a mild to moderate reading impairment. She did well with simple reading tasks, but couldn't answer more complex questions. Our client also had a severe writing impairment. She could copy shapes and numbers but couldn't produce an automized sequence like the alphabet. So we should write goals for all 4 modalities, but focus specifically on talking and writing since they were the most impaired.